Good afternoon. My name is Linda Freed, and I have the deep honor of being the Dean of Columbia University's Mailman School of Public Health, and today of introducing a real visionary in the field of public health and an alum of the school, Dean Roberta Ness. I'd like to introduce Dean Ness for a couple minutes and then introduce the topic, which I think is critical to what the theme of this Grand Round series is, which is the future of public health. Roberta Ness is a world-renowned expert in women's health research and became Dean of the University of Texas School of Public Health 2 years ago, November 1, 2008. She's the school's fourth dean and comes from a background that I think is near and dear to our heart. A physician who graduated from Cornell University. She got her MPH here at the Mailman School of Public Health. She has been since that time, she has been at the forefront of women's health research, being one of the first to propose the research paradigm and scientific paradigm, now termed gender-based biology, in her book entitled Health and Disease Among Women. To quote from Dean Ness, she says, gender-based biology is really, at its core, thinking about the differences in health between men and women as a classic experimental paradigm. Dean Ness has continued throughout her career as an innovative scientist and leader, both in terms of the areas that she focused on, in terms of their high import, and in terms of the questions she has asked. And she has made significant contributions in the epidemiology of ovarian cancer, preeclampsia, pelvic inflammatory disease, adverse pregnancy and perinatal outcomes, links between reproductive history and cardiovascular disease, and bacterial sexually transmitted infections. She is a frequent advisor to the National Institutes for Health, the Centers for Disease Control and Prevention, the Agency for Healthcare Research and Quality, and the Department of Defense, and has taken part in several Institute of Medicine reports. She comes to being the Dean of the University of Texas from her long tenure as the chair of the Department of Epidemiology at the University of Pittsburgh. And I'll mention parenthetically that the Dean of the University of Pittsburgh will be co-presenting Grand Rounds next month with Sandra Galea on a cutting-edge issue in public health, which is systems science. Dr. Ness is past president of the American College of Epidemiology and has served on its board of directors since 2004. Recently, she became the founding chair of the Joint Policy Committee of the Societies of Epidemiology, the first organization to coordinate joint policy actions among 14 epidemiologic societies. She has numerous honors and awards and has really been a pathfinder in all the areas that I have just described, but she has really brought them together in a venture that I think captures the heart of this school, captures my heart as a scientist, and I think is increasingly capturing the heart of science broadly, as exemplified by her being lead speaker at October's National Annual Meeting of the Institute of Medicine on the topic we're going to hear about today. And the topic today is appropriately, for the scope of what she's taking on, titled The Future of Public Health Innovation. So why are we concerned about this? Well, at the moment, of course, the school is engaged in what I think is an historic all-school, all-faculty enterprise in envisioning what the future of public health education should be and in innovating in creating it, even as we're teaching highly innovative science and contents of public health right now. But as Dean Ness said, and I'll quote her a second time, innovation is the engine of health and prosperity, and we would both add, of science. And the role of great schools of public health, and the role of universities, and the role of science is to innovate for our future. So if the responsibility of great universities in the society is to create the knowledge and the leaders for our long-term future, and to create the most impactful and innovative ways to solve the health concerns and challenges that human beings will be confronted with through the coming century, then the key is going to be how to solve emerging problems as well as current problems in the most innovative ways that can be impactful beyond our current dreams. We are committed to science at that level, and we are committed to educating our students in that way, because you all will need to lead in understanding how to innovate and to carrying that forward as a foundation of your own careers. And so today, to bring together all of the threads of what we are engaged in, I am truly thrilled to welcome to the podium Dean Roberta Ness to talk about the future of public health innovation.
Well, thank you, Mom. Dean Freed. That was a lovely introduction. Unfortunately, I don't have to give a talk now. She just did it. This talk really is talking about, as Dean Freed just said, and I just want to thank you very much for the invitation to come. And also, I've had a delightful opportunity to engage with a number of your leaders, university leaders today, talking about what you're doing in this innovative curriculum rediscovery, and it's really phenomenal. I give you many kudos for doing that. But I'm going to be talking about some of the future challenges in public health, and then I'm going to be talking about the very critical nature of innovation in solving those future challenges. So if I told you that that this was a little party that I had in my backyard a couple of years ago, and I invited the neighborhood kids to come over and have a smoke with me, what would be your reaction to that? You think that was unusual? I mean, that's what y'all usually do on a weekend afternoon? No? Okay. Well, if I then showed you this picture, more doctors smoke Camels than any other cigarette. Anybody ever seen this picture? Okay. And I told you that this was normative. This was a very, very commonly disseminated marketing advertisement in the early 1960s. Would you think that that was unusual? It wasn't unusual. It was, as I say, it was normative. Now, clearly, the first picture is non-normative, and the second picture, for its time, was absolutely where society was at. You know, they say a picture is worth 1,000 words, and I think that the combination of these two really is, because it shows you how far public health has come in a generation. So, the Centers for Disease Control estimates that of the 30 years of life gained in the last century, so between 1900 and 2000, that 25 of those years are attributable to public health and prevention. That's how powerful public health is. That's how important the societal, the normative change has been from accepting smoking as an extraordinarily common behavior amongst Americans to really not accepting smoking at all societally. And public health has had many, many, many triumphs over this period. I'd be extraordinarily hard-pressed to name all of them, but these are just a few. The discovery of the relationship between folate and neural tube defects, resulting in folate fortification of wheat products in this country, the identification of hepatitis B and its link to liver cancer, which kicked off the worldwide campaign to eradicate liver cancer through hepatitis B vaccination, again, smoking and lung cancer, the decline in cardiovascular disease from the now known major risk factors, including hypertension, hyperlipidemia, and others. And interestingly enough, notably here in New York City, the association, the now known association between salt and hypertension, and the new campaign to reduce salt in processed products, and on and on and on. So we have been part of a triumphant period in human health, in public health. But I would put to you that despite all of the extraordinary gains that have been made in the last century, in the last generation, that humanity is confronting some of the greatest challenges of humankind, of our history. In some of the health problems that continue to confront us and in fact are growing and growing on the horizon. This first one, so the first part in the first part of this talk, I'm going to describe to you a project that was undertaken by the Joint Policy Committee of the Societies for Epidemiology, in which we kind of put our heads together as epidemiologists from across the globe in thinking about what some of these great challenges are. And again, this is not meant to be universal. It's not meant to encompass everything, but it's just meant to give you a sense of what some of the great challenges are that confront our future. Certainly, the disparities in health are a huge looming problem that, of course, has been a massive problem for all of human history. But I think increasingly the world understands that those disparities really affect all of us and threaten all of us, because we are now a global society with massive human migrations and the eco-environment, the environment affecting all of us, and the speed of travel, meaning that infectious diseases speed around the globe. We really understand the imperative to reduce these inequalities in health as articulated by the global Millennium Development Goals, which were very, very broad-based around education, poverty, and the environment, powerfully linked to health. But we really fundamentally do not understand what that means. We understand that education, that poverty are some of the strongest influences on health, but we don't know what that means in terms of how to intervene. How do you launch an intervention program that the goal of which is to enhance education? It seems kind of overwhelmingly large. Environmental issues, global warming portends extreme swings in weather, loss of flora and fauna speciation, long-lasting alterations in our environment, but environmental health is frankly poorly poised at this point to answer these kinds of very large mega questions, because the methods that are used are more micro, they're better at looking at kind of micro questions than they are at looking at these massive macro questions. And I think that we've really, in a sense, lost the imperative around even the conversation around environmental health as it impacts, around environmental issues as it impacts health. Obesity and diabetes are clearly growing epidemics around the world. It's estimated that 1.6 billion people worldwide are overweight. And we know that it's all about prevention here, because we know that actually treatment doesn't work terribly well. Once an individual is obese, it's extraordinarily difficult to get them to lose and retain weight gain to a normal weight in the absence of surgery. And so this is a very difficult question. And yet, remarkably little is really understood about the etiology of what's driving the obesity and diabetes epidemic worldwide. We have lots and lots of theories, and everybody has their pet theories, but the fact of the matter is we truly don't know, which is why the epidemic continues to grow and grow, and we are unable to do very much at this juncture to intervene. So a great future challenge. Aging, I put this in for Dean Freed. No, it was actually identified as a major issue in the project. We understand that aging, of course, is a normal process, but with aging comes disability, and disability will be increasingly a huge challenge internationally. So we are confronting the kind of turnover in the pyramid. It used to be, as you see here, let's see, I guess I have a pointer. It used to be that the age structure in the world was pyramidal, and in many developed countries it's becoming an inverse pyramid, and being able to support that top of the age structure with long-term care for the disabled, with maximizing active life expectancy and reducing disability is a huge challenge that, again, we understand much less about than we really need to. We have very few insights about how to predict, how to treat, how to prevent the disability associated with aging. More and more drugs come on the market, both in the United States and worldwide, and we recognize the need for better safety, increased comparative effectiveness research, but we have limited tools to be able to really affect what is an effective, cost-effective safety program. Databases, efficient methods, all of those are really new contextual moves forward that are needed in this area. And of course, emerging infections, we think it's almost comical now that in the 1970s, many world leaders said it was the end of the era of infectious disease, right at the time that we were about to experience the HIV epidemic. But with HIV, with Ebola, influenza, antibiotic-resistant bacteria, and many other new threats on the horizon, we now appreciate just how important it is, how important emerging infections are. And I would also note that increasingly we understand the link between chronic diseases and infectious disease. So we clearly need better surveillance programs. We need more uniform field-based epidemiology in this regard. But we also need novel approaches in vaccine development, prediction of what communities are at risk, and et cetera. All of that requiring innovation. So the point is that we've done a lot. I think we should be very, very proud of what public health has accomplished, but clearly this is not a time that public health can sit back on its laurels and say, you know, good work, we've done a great job. In fact, your generation is confronted, the next generation will be confronted with enormous public health challenges, and if we don't confront those public health challenges, we will all be, you know, not as long-lived and not as prosperous as a world. So I argue, and many others have as well, that innovation is the engine of health, prosperity, and science, and that in order to overcome these issues that I've just related to you and many others, will take innovative approaches, will take completely novel, entirely new approaches. Those kinds of paradigm-shifting approaches are what I'm going to call big I innovation. And I don't think that just kind of small steps are going to solve many of these problems. So before I start talking about innovation, I think we need to kind of get on the same page about what innovation is. So I want to try to define it for you, and I would call it applying a creative process towards an improved product with two components of that. One is this thing I've just called big I innovation, which is creating breakthroughs, new technologies, paradigm shifts, revolutionary kinds of thinking. But the other one that can be equally important are, in fact, making existing resources better, faster, cheaper. They are what I would call little I, or evolutionary rather than revolutionary innovation. And those kinds of innovation can also be transformative. Things like your cell phone, the MRI machine, the Green Revolution, the safety procedures in hospitals around many things have all been step-by-step modifications, more linear rather than heuristic processes of innovation, but also very, very important. So what I'm going to try to convince you of for the rest of this talk is that innovation, as important as it is not something that people are born with. It may be in part something that people are born with, but it can also be taught. That my belief is that you can take any person at whatever level of innate creativity they have and teach them to be more creative. And interestingly enough, in some disciplines outside of science, such as in business school, this is a belief system. Innovation, creativity is taught in many business curricula. It is virtually never taught in science as a method. And when I've talked to colleagues about why that is, they truly believe that innovation, you're born with it. It's temperamental. You either have it or you don't. But again, what I'm going to try to convince you is that it actually can be enhanced through teaching. So the first thing that I'm going to tell you is that there's a literature on this, that for the last generation there have been a series of programs, innovative training programs or creativity training programs, that have been launched and evaluated. And in 2 recent meta-analyses, a number of these studies have been examined, and it's been shown that they can increase fluency of thinking, so that's how many ideas you can generate, how quickly, novelty, so new ideas, and originality, by 2 to 3-fold. So they're quite powerful in terms of being able to influence thinking. And moreover, they translate into real things like increased problem solving, better attitudes towards novelty, and actually work performance. Not only that, but these programs appear to be pretty robust in the sense that independent of age, gender, intellectual capacity, or professional or academic setting, these programs demonstrate those kinds of effects, those 2 to 3-fold increased effects in fluency and originality and such. This is just very quickly, and I'm going to not even try to really walk you through the data very much, but this is very, very early data that we have from our own experience in adopting an innovation training program to science for the first time. And in a small number of students who did the both before and after assessments, we actually were able to show overall and in flexibility, fluency, and originality of thinking, really these huge increases. So, 300+%, 200+% increases in each of these venues. By the way that these things are done, I'm sure you're wondering, like, how do you test this? There are actually these things called standardized creativity tests. The classic one is called the Torrance Test for Creative Thinking, and it's been used for a generation. So what these are is really a pre-test and a post-test on the Torrance Test of Creative Thinking, and that's what the others, the meta-analyses used as well. So I want to just extremely quickly go over with you some of the conceptual components of how do you do this? How do you actually teach people to think differently? And the 3, I think, major components to this are recognizing and finding alternatives to our habitual cognitive patterns. And so those are really our paradigms, our frames, our normal way of thinking. So even recognizing our normal way of thinking, believe it or not, is a difficult thing for students to do, because these things are so completely ubiquitous. They're so entrained in us. They're so part of the way that we think that we don't even recognize that they're there. The second thing is basically learning a series of tools that enhance idea generation, so that fluency, flexibility, originality. And then finally, aligning this, what's called divergent thinking. So divergent thinking is coming up with lots and lots of different crazy ideas with the scientific method. So everything obviously has to come back to our convergent way of thinking, our critical way of thinking within the scientific method. So first, these habitual cognitive patterns and their implications. So linguists first created this terminology, which is frames. Frames, or we might call them our paradigms in science, define the way that we communicate and think. Frames are effectively expectations and assumptions, such that when you're confronted with new information, you draw certain inferences. So let me give you an example, because I'm sure you have no idea what I'm talking about at this point. So an example would be going to a restaurant. So when you go to a restaurant, you have a universal set of expectations. No matter where in the world you go to a restaurant, you apply this set of expectations. Your set of expectations has something to do with being served by someone who is polite and getting food and paying. So those would be, some of the absolutely universal expectations. What would happen if you were in a restaurant and you said to the waitress, would you mind bringing me some more water? And the waitress scowled at you and said, go to the kitchen and get it yourself. How would you respond? Right? You'd be surprised. You'd be maybe angry. But you certainly would be confused and you wouldn't know what to do next, right? I mean, so is this woman psychotic? This actually happened to me in New York City, I have to say, when I lived here previously. But anyway, but you absolutely, it would stop the conversation. It would stop the social interaction. You wouldn't know what to do next. Our frames, our expectations, and our assumptions are the grease that helps us to basically slide through complex social interactions all the time with no problem whatsoever. We all have this pretty much a common set of expectations. So that would be a breaking of frames. In the classroom, we help our students to identify their frames, and we help them to identify the implications of those frames by giving them these kind of mind problems. So Gary and Nancy are lying on the floor dead. Around them is a puddle of water and some broken glass. What are the circumstances of their death? You don't have to shout out an answer. Just think about it for a second. Okay. So they're fish. Their fish tank broke and they suffocated. Okay, now, let me just walk you through that a little bit. Gary and Nancy are lying dead on the floor. How many of you saw one of those classic pictures of a male and a female body with, the yellow outline around them, and you're the detective, and there's the, yellow tape that says caution and whatnot? How many of you did that in your head? Right, almost everybody, right? Okay. How many of you thought, oh, Gary and Nancy are fish? Or a few of you, okay. Have you heard this before? Is that, yeah, because you heard it before. Okay, well, so you're cheating, all right. There are always those in the class, the reason why you didn't jump to the conclusion that Gary and Nancy are fish is because in our frames, in our normal frames, names imply humanity. So I purposefully took you down a course that I knew was, frame concordant, and I knew that it was very unlikely that you were going to come up with this other notion. But that is, again, that's a frame shift. That's an alternative frame that makes total sense once I tell it to you, right? All right, let me take that into the realm of public health. So Herb Needleman, who is actually a good friend of mine, first at Harvard, then at Pittsburgh, how many of you have ever heard the name Herb Needleman? Oh gosh, in environmental science, I sincerely hope you have. Okay. So Herb Needleman is what I like to call my most famous friend. He's the grandfather of lead research. He was the person who, with a very few other people, really established the link between lead and neurocognition. So what he basically showed is that a mother's lead level affected her child's cognitive status years into the childhood, that a child's amount of lead in his teeth affected their cognitive function all the way up through high school and beyond. Herb Needleman was a frame shifter. He was a paradigm shifter. Why do I say that? Because when he came to the field, he was confronted with the following scenario. His first patient was a little girl. This was in the early 1970s. And she was lead intoxicated. And he did what every doctor would do at that time, which is he gave her a chelating agent, and she went from being comatose to laughing and walking again and left the hospital. But before she left the hospital, he said to her mother, so, okay, this child has clearly been eating lead paint chips, and she needs to stop doing that, and probably what you are going to need to do is you're going to need to move out of that house that has peeling lead paint, or you're going to have to repaint it. And the mother said, well, that's all well and good for you to say, but I can't afford to either repaint my house or to move to any other house that doesn't have peeling lead paint. And suddenly at that moment, Herb Needleman thought to himself, this is not an individual clinical problem. This is a public health problem. This is a problem of an intoxicated environment, not a problem of an individual intoxicated patient, right? We can't solve the problem by simply telling each child not to eat lead paint. We need to solve the problem by changing the environment. And ultimately, he and a few others were responsible for the policy changes wherein lead was removed from paint and gasoline, and we now have a childhood population where levels of lead, blood lead, have fallen by orders of magnitude. So he was a frame shifter. Now, metaphors are the linguistic way in which we articulate our frames. So I'm going to tell you that if you can identify the metaphors that we very consistently use, you can frequently identify the frames. Again, remarkably, these frames are very difficult to identify. For instance, I was talking to Dean Fried earlier before we came about the notion of our frames around ideas. This is so completely embedded in science. Can anybody think of how do we frame the notion of ideas? Any suggestions? How do we think about our ideas? All right, y'all are now afraid of me. Come on, anybody.
Product of intellectual energy.
Yeah, absolutely. Think about metaphors related to ideas. How do we talk about our ideas? How about, don't let anybody steal your ideas? That idea is a really worthwhile idea. That idea is going to pay off. What do those metaphors tell you about our frames around ideas? I'm sorry? They're possessions. We own them. They are marketable products in our capitalistic society, right? That has lots and lots of implications. One of the implications is that we don't share our ideas. One of the interesting repercussion of that implication was back to Alzheimer's disease research, aging research. For decades, we made almost no progress in the prevention and treatment of Alzheimer's disease. It wasn't until about half a dozen years ago when a consortium was created called ADNI that we started making massive progress in this field. And I would posit to you that the reason why ADNI was completely frame shifting was because it threw out the notion that ideas are owned. the way that you could get funded through ADNI, which was a multi-million-dollar funding consortium, was that you had to promise that you would never patent an idea that came out of ADNI funding. And by the way, every piece of data that comes out of ADNI is instantaneously put on the internet. You don't get 6 months, a year to publish. You instantly put your data up on the internet. So it shattered the notion of idea ownership. It shattered and instantly, and within, I shouldn't say instantly, but within a half a dozen years, broke through what had been a complete barrier in Alzheimer's disease research. So let me give you another example. Our metaphors around, our frame around the whole relationship between man and disease is a war metaphor. Think about every way that we talk about research on or clinical care around disease. It's eradication, elimination, battling, overcoming. It's completely a war metaphor, all right? The implication of that war metaphor is very great, especially let's take the example of cancer. What that means is that we endorse the idea that you can burn, poison people, even at the end of their lives. You can torture them, essentially, and that's good. We want that because we're overcoming this battle against this horrible enemy called cancer, all right? So we endorse that. Moreover, we have tremendous tension in our society around things like screening for breast cancer in the 40 to 49-year-old age group because we have to eradicate every cancer, no matter what the cost is, right? So there are great implications to the notion, to our frame of the war on cancer. What if I were to posit an alternative metaphor and I were to say to you, let's think about cancer not as our enemy but as our neighbor? And you would say, wow, she is so weird. Let me explain to you what I mean by that. So Robert Frost said, good fences make good neighbors. Many of us don't like our neighbors. We fence our neighbors out. Certainly countries constantly are containing themselves against their neighbors. If we thought about cancer in that way, we thought about not so much eliminating every cancer cell, eliminating every cancer, but we thought about containing cancer so that they don't metastasize and they don't kill us. So what would it be like if we said, it's really okay to have cancer? It really is, as long as it's not a kind of cancer that's going to kill you or disable you, all right? It would be a completely different way of thinking, both biologically and from a public health perspective, about cancer. We might think from a research perspective, for instance, about immunologic strategies that would contain cancer by enhancing the host immune response. Or we might think from a public health perspective about trying to screen not for every cancer, but for only those cancers that are going to kill. So a very different kind of screening modality. So frames not only affect our thinking, but they literally affect our seeing. They literally affect what we visualize. Here's a great example that comes from New York City. How many of you heard about the Diallo case? Are you familiar with this? So many of you are. In Houston, most people aren't. So Amadou Diallo, as you know, was this tragic situation of a police shooting. And the situation essentially was that this Haitian immigrant was standing outside of his own brownstone at about midnight. It was not a good neighborhood in the Bronx. And a group of plainclothes police officers came up, and they looked at him and thought, that's really strange. Why is this guy just standing there looking around? And they figured, well, probably he's selling drugs. And he looked a little bit like a rapist who had been in the neighborhood a year earlier. And so they stopped and they came out, these three big white guys came charging out of the car with their badges borne and said, police, don't move. And Diallo, who didn't understand English terribly well, had no idea what was going on. These guys are racing at him. And he goes for the doorknob, and with his other hand, he starts putting it into his pocket. And they basically say, gun, he's got a gun, and open up, fire on him, kill him. And when he's lying in a pool of blood on the ground, they appreciate that in his open hand that had been in his pocket, was now out, he has, did he have a gun? Do any of you know what he had in his hand? He had a wallet. He was reaching into his pocket to get his wallet because he thought these big white guys were trying to mug him. And he was trying to get his wallet out for them. This is a classic example of a framing problem. What those three police officers didn't recognize in Diallo is what any of us under other circumstances would have instantly recognized. And that was that Diallo was not aggressively reaching for a gun. He was terrified. Now, typically, we can see that on somebody's face, right? But in that split second where these police officers were in the frame of, it's midnight, this is a bad neighborhood, this is a Haitian guy, he's reaching for something in his pocket, they didn't see that. They were in the frame of, this guy is a drug dealer and he's going to shoot us. So, observation is very affected by our frames. Now, how do we take that into science? Warren and Marshall won the Nobel Prize for this discovery of the relationship between H. pylori and stomach cancer, okay? Robin Warren, was an Australian pathologist. He was a clinical pathologist. He was just doing his job. And he happened to notice in the specimens, in the histologic specimens from peptic ulcer disease patients, that in the crypts of their gastric tissue, they had these funny-looking things that looked like bugs. And not only did he find it once, but he found it in like 60% of all of these specimens. Now, Robin Warren wasn't using any special microscopic equipment. He wasn't using any special stains. He was just a clinical pathologist doing his job. Why was Robin Warren the only guy who saw this? And I would posit to you that the reason is because the belief system at the time was that bacteria could not live in that environment, that the pH was too low to be able for bacteria to survive. Moreover, there was another part of this. We already knew what caused peptic ulcer disease. We knew, right? There were lots of epidemiologic studies that basically showed that stress and low acid pH caused ulcer disease. We already had medications developing like cimetidine and others, right? So we already knew the answer to this question. We didn't need another answer, right? So Warren and Marshall just got all sorts of backlash for this. Nobody believed them. They had to go through hell and high water to convince the medical community that in fact it was possible for a bacteria to cause peptic ulcer disease. Today, we of course know that an enormous proportion, maybe 80% of peptic ulcer disease is contributed to by H. pylori. But observation was massively affected by frame. The other aspect of frame that I just want to point out to you that I think is very important and I think is almost always overlooked, and that is that part of the reason why I think frames are so powerful, and they are truly ubiquitous and powerful, is because they are emotional. If I break your frame, you don't just react by saying, let me think about that for a minute. Let me kind of be intellectual about that. You actually literally have a visceral reaction. You literally have an emotional, visceral reaction. So if I were to say to you, when I said, cancer as neighbor, y'all thought, really? Similarly, if I were to say to you, I have this great experiment that we're going to do. We're going to go into New York City. We're going to take some of the most trafficked intersections in the city, and we're going to remove all the street signs and all of the signals. Isn't that a great idea? You like that? You'd say, oh my God, she's crazy again. Get her out of here, right? I mean, you have a visceral reaction to that. You don't think, all right, let me think that through carefully. All right. As it turns out, there are half a dozen European cities at this moment that are trying this experiment. Why? because in their estimation, when cars are in very, very busy city environments where there are pedestrians and there are bicyclists and there are all sorts of things coming at you, if you're paying attention to the signs and the signals, you're not paying as much attention to what is actually literally around you. And the guess is that that is actually more distracting than it is helpful. When you remove signs and signals from city centers, people slow down a lot. They really pay attention, and less people drive. So, in summation, this first step, which I wanted to spend the most time talking about because I think it's the most difficult to understand in some ways, is frames are ubiquitous. They determine what we see and what we miss. They're emotional, and innovation requires jumping out of those frames. So now, tools that enhance idea generation. So we use a whole series of tools to help people generate ideas that are out of frame. So how do you get out of those frames? How do you come up with these alternative ideas? The first one, and one that has been used really ubiquitously in science, is this notion of analogy. I'm just going to, there are a lot of examples, but I'm just going to give you one because we're running out of time. Jenner, I'm sure you're familiar with this one, basically recognized that milkmaids rarely got smallpox, and so he hypothesized that the reason why was because they got cowpox from milking cows, and that cowpox provided protection against smallpox, and he thereby developed the first vaccine strategy, which was using the pus from cowpox to vaccinate against smallpox. And interestingly enough, if you want to talk about a true risk taker, one of the very first people that he vaccinated was his 1.5-year-old son. So he really believed this. In the classroom, one of the strategies that we use to get people to understand this notion of analogy and to practice it, let me just go back for a question. I keep talking about, I'm talking about kind of an example, and then I talk about in the classroom when we do this and how do we relate it to science. That's exactly the way that we teach, is going through that kind of 3-step process. We define the idea, we bring it into science, usually through historical examples, but then we also do lots and lots of practice, because like any method, whether it's learning to play an instrument or learning to think a different way, it's all about practice. You cannot listen to this for an hour and say, oh, I'm going to think differently. You can't even go through a 14-week curriculum, which is what we do, and say, oh, I'm going to think differently. You have to practice it over and over again to actually use it. So we go through these kind of crazy analogies. First we go through kind of standard analogies, but then we do analogies like, how is a marriage like a matchbox?
Incendiary.
Yes, thank you. Both can be incendiary. Well said. They can both go up in flames, as my students say. Any other ideas? How is a marriage like a matchbox? Well, I'll just quickly, one student pointed out to me that they both have 8 letters. How smart is that? And another student said, you can pick them both up in a bar. All right, another tool, expansion. I use this tool a lot in my own thinking. I'm going to give you an example outside of science. I think it's a fantastic one. In the 1950s, the shipping industry was going broke. It was being confronted with competition from a lot of other industries that could move goods and services across large spaces like air travel and such. And they simply couldn't make it economical enough. And they kept asking themselves the question, how do we make shipping more economical at sea? Now, usually in most industries, personnel is the answer to that. So they cut down on the number of crew, they built ships that could move faster, and still it was just not, they were not competitive, and they were going broke. Finally, they brought in a consultant that expanded the question and asked not how do we make it more economical at sea, but just how do we reduce costs? And suddenly what they realized that was the largest fixed cost in the shipping industry is the ship. They're very, very, very costly, these huge ships. So what they appreciated was any time that a ship is not working, it's not like they were focusing on what happens when you have people not working. But the problem was when the ships weren't working, they were losing money. When is a ship not working? When it's at dock, thank you. When it's at port. I have a ringer in the audience who's asking, you're going to be quiet, everybody else is going to talk, okay? I mean, you always have one of those students sits in the front row. Anyway, this was actually the genesis of container shipping. This was the development of the whole current modern notion of building container ships. In science, a beautiful example of expansion is the Darwinian theory of evolution. Darwin's theory of natural selection, actually, his thinking first started when he was asking the question, just like everyone else asked the question at that time, which is, how does each life form fit with others created by God, right? Because all life forms were created by God. That was a truism, that was known, right? And ultimately, after more than 20 years of work, Darwin came to the conclusion that that wasn't the question. The question was actually, how did all life forms come to be? As soon as you expanded the question beyond the idea of this kind of religious and spiritual way of creating life, he ultimately came to this notion of natural selection, which has nothing to do with a deity. Another tool that we use, so we talked about analogy, we've talked about expansion. Another tool, by the way, kind of the opposite of expansion is also a very useful tool in innovative thinking, which is taking things apart, taking things and dissecting them into pieces that you can kind of innovate around, which I'm not going to go into. But reversal is a very interesting one. So basically taking a question and turning it on its head. One way to reverse a question is to negate it. Another way to reverse a question is to take cause and effect and flip them, all right? The example I'm going to show you is the negation one. So in medicine, we talk about the presence of disease, and in public health, we talk about the absence of disease. The implication of what I call obliviousness to absence is really huge, and I'm sure many of you are aware of it. I think all deans of schools of public health are very aware of it. We don't have, grateful patients, right? We don't have people who every day wake up and say, thank goodness I'm not going to die of bloody diarrhea today. Thank goodness, right? I mean, that just doesn't happen. We take those things, absence is not something that we think about. So it's very hard to get people excited about this reversal that public health represents, and it's hard to get them to comply with things that are not affecting them right at that moment. So for instance, if you have somebody that's suffering from a heart attack at that moment, that person will do anything, right, to fight that disease that's happening to them at that instant. They'll allow somebody to crack their chest, right? But on the other hand, if you have somebody who is preventing getting cardiovascular disease, getting a heart attack, it's very, very hard to convince them very frequently to reduce the sodium in their diet, to take their hypertension pill every day, to take their statin every day, and et cetera, et cetera. One of my favorite tools in our toolbox of idea generation is called POE. This is an idea, it stands for provocative orientation. It came from a fellow named de Bono, Edward de Bono, who is kind of the grandfather of creative thinking and wrote a book called Lateral Thinking a generation ago. POEs are what I call counterfactuals. They're notions that on the face of them don't seem to make a whole lot of sense. What we ask our students to do to get them, just to get their ideas flowing, to get them thinking out of their normal patterns of thinking, is to try to come up with all the reasons why these are just the greatest ideas in the world. So to basically try to prove these concepts. So cups are made of ice. This is a particularly good one in Houston, where we have slightly hot summers. And people think cups made of ice. Oh, that is not a good idea. And that's kind of a knee-jerk reaction. So we try to get our students to come up with all the reasons why cups made of ice are a great idea. And I would posit to you that they are a fabulous and outrageous idea, and I'm very, very surprised that we don't have ice cup manufacturers, right? Okay, so why would cups made of ice be just a grand idea? Someone other than the ringer in the first row. I can't hear you, so you have to... Yes, incredibly environmentally friendly. They are made of water, a renewable resource. Why else? No waste. I'm sorry? They keep your drink cold. Of course they do. They keep your drink cold. Fantastic. So no waste, very inexpensive to make. They keep your drink cold, lots and lots of things. Think about it. Vermont in the winter. Why don't we have cups made of ice? Right? So these other ones I'm not going to go through with you, but fat people should get paid more. Think about it. Lots of good reasons for that. May not come to mind immediately, but my favorite, only women should serve in the military. So think about why these actually fully make sense. Brainstorming is a process of the power of groups that we rarely use in science. I was delighted to hear that this was a process that you used in your curriculum revision. I can never remember. What is it? Renewal. Thank you. Revisioning, renewal. There are all those R words. Your curriculum renewal project. But it's amazing how little we use true brainstorming in science. But you can do it on an individual basis. You can do it on a group basis. On an individual basis, we have students do things like imagine in 3 minutes everything that you can write down for how you can use a book, how you can use a hairpin, a pen, a brick, all right? So those are really, really good practice exercises in developing fluency and originality. In terms of group process of brainstorming, it's become increasingly clear that groupthink can be very, very powerful. Here's a great example. How many of you have ever heard of the DARPA Red Balloon Project? A few of you, good. So DARPA is the department is the section of the Department of Defense which is engaged in very high risk, very innovative projects, funding those kinds of projects. And DARPA came out with this challenge. They put 10 8-foot-high red balloons, weather balloons, fixed in places that were easily seen, but all around the United States. So 10 of these balloons, 8-foot balloons, 10 of these balloons were fixed some random place around the United States. The United States is a pretty big place. And they basically said, we will give dollars to the first person or team that can find all 10 of these red balloons. A team from MIT immediately came together, immediately came together and used the internet to solve this challenge. And they were able to solve the challenge in less than, what do you think? How long do you think it would take to find 10 balloons fixed, if you know the answer? I mean, if you already read this, don't ruin it, but just guess. 10 balloons anywhere in the United States, how long do you think it would take? 3 hours. 2 weeks. Okay. Actually, it took less than 12 hours. So you were pretty right. The way that they did it was not only powerful, because this is a great, we know the power of the internet. You can kind of put balloon detectives all over the United States over the internet, but it was also innovative, interestingly enough. And what they did is they used a pyramid scheme. See, pyramid schemes can be used for both ill and for good. And what they did is they basically said, if you find a balloon, we'll give you a certain amount of money, of the prize money. If you find somebody who finds a balloon. So if you bring somebody to the site who then finds a balloon, you get half that amount of money. If you find somebody who finds a balloon, you get a quarter of that money. And so they developed this pyramid scheme, and they found all the balloons within 12 hours, the power of groups. I was fascinated by this article that just came out this past year, late in 2010, in which this notion of the power of groups was actually scientifically proven for the first time. So what Woolley et al. Did, published in Science, was they set groups to what are normally individual intelligence tasks, okay? And then they asked the question, what predicts the performance of these groups? The first thing that they found was that these groups, that group performance was ranged widely. So group intelligence ranged widely. But it wasn't correlated very strongly with the individual intelligence of the group members. What it was most strongly correlated with was the social sensitivity of the group, i.e. the inclusiveness of the group. So, isn't that cool? So the process of brainstorming is all about divergent thinking. It's all about throwing every idea against the wall you possibly can without any judgment whatsoever. Just throw it up as fast as you can, right? Everybody participates. Later, there is a process that we use in critical thinking, which again is called convergent thinking, whereby you sort through all those ideas. And by the way, not the whole group does this typically. This becomes kind of dictatorial. So you sort through all of those ideas, you categorize them, you prioritize them, and you say, this is the set of ideas that we're going to kind of move forward. And that takes us to the last step of this, and that is this idea of harmonizing idea generation in the scientific method. So this is the classic scientific method. We have hypotheses, they lead to certain expectations. From those expectations, we make observations and see whether those observations match our expectations. From that, we draw inferences, and we go back and revise our hypotheses. So this kind of circular process. And innovation can, as you can imagine, can come in at pretty much every stage of that process. Innovation can inform the hypotheses that you generate. It can actually change the expectations that you have. It can obviously influence, as I've said, your observations and clearly your inferences. So this stepwise process of harmonization looks something like this when you put it all together. We teach students how to define a problem, which is a very, very critical step. So how do you actually come up with a question that you can even begin to innovate around? We teach them how to gather information, and that information gathering phase is not just going to your own little literature and looking at what's been done before. It's very broadly reading literature that could possibly in any way relate to your question, and best if it's outside of your own discipline, and moreover informing yourself through direct observation. So when you think about, we were talking earlier today about these very innovative design firms like IDEO and Pixar and others. There's a great story in Pixar about how they did, was it A Bug's Life that they did? Was that the Pixar film? I think it was A Bug's Life. To inform A Bug's Life, what they did is they actually developed this little teeny tiny camera that they zoomed around the ground so that literally they were looking up at the plants. It was a bug's eye view of the world. It was wild, you know, and that was the genesis of how they created all the scenarios in A Bug's Life. So it's very, very important to actually observe on your own, to go out of your frame, out of your comfort zone, and actually get direct information. The next thing is that we identify what our frames are around this question, and we generate alternative frames and then generate lots of original ideas. And then we converge on the most useful insights and hypotheses and then develop an action plan for validation and to test those hypotheses. So I'm just going to try to explain that to you, I'm going to give you a real example from my class. So from last semester, I'm teaching the class again now. Last spring, so in the class, we have these projects, group projects that we do, where they go throughout the semester, they actually go through every step of that and ultimately come up with this group project. This particular group asked the question, how do you increase the number of people who have living wills, otherwise called advance directives? Now, this problem of not enough people having living wills is a real problem in the United States because it contributes to the fact that we spend a quarter of all Medicare dollars in the last 6 months of life. So we do a lot of things to people that they actually really don't want done. And really just, prolong their life, but also prolong their misery. So they asked this question, how can we change that? And they realized that, so what they did is they framed the problem, again, how do you increase the number of people with advance directives? Then they went out and not only reviewed the literature, but they went out and they talked to families and patients and providers, talked to a lot of different people about what was going on. And they realized that the frame with which we think about advance directives is a frame about how we think about death. And death is very scary, it's sober, it's mysterious, it's guilt-ridden amongst families. Families don't want to talk about it. They want to just put it off and not deal with it. And so we approach it with awe and fear, or we don't approach it at all. So they said, how about this alternative frame? Benjamin Franklin said, the only things we can be sure of are death and taxes. How do you apply death and taxes to the idea of advance directives? And they came up with this form. When they first gave it to me, I said, why are you giving me a tax form? And then I actually looked at it, and it says, the U.S. Individual Advance Directive Claim Form. And the idea was that every year, when you fill out your tax form, you would have the U.S. Individual Advance Directive Claim Form, and you'd fill this out and you'd submit it annually with your taxes. And on this form are things like, I elect to not appoint any other person as my health care representative, or I appoint the following person as my health care representative, and I do want this or I don't want this, and it goes through this whole kind of, I'm only showing you the top of it, but it goes through this whole series of check boxes that look exactly like a tax form. So what they had basically done is they had shifted the frame from being this frame of, oh my gosh, it's so scary we don't want to talk about it, to, oh my gosh, it's so bureaucratic that we hate to do it, and it's a complete pain in the butt. We have to do it like our taxes, but we do it because it's just bureaucracy, right? So that's all I wanted to tell you. So in summary, I strongly believe, and I hope you do too now, that innovative thinking can be taught, that it is a method, that with practice you can get better at it, that one of the very key things is learning to think outside of your normal cognitive habitual frames, that there are lots of tools you can use to help yourself, and that it actually can be integrated back into the classic scientific method. So thank you very much for your attention, and I appreciate being here. Thanks.
Thank you, Dean Ness, and we'll take questions from the audience. We, in particular, welcome questions from students. The first question comes from Dean Freed.
Roberta, thank you for a fabulous presentation, which we intend to learn from and build on in ongoing innovation here. I have an invitation for the audience before we get going with your questions, and a question for you. The invitation for the audience is to join us once we have about 15 minutes of brainstorming with Dean Ness for a reception just outside the door for all of you and for our speaker. My question has to do with brainstorming and group science. So there is a lot of experience at this point that teams of scientists working together across disciplines not only do a better job often on the things they already intended to be working on, but in fact often end up creating what jargon would describe as transdisciplinary science. So something they never even imagined before, any of them,
Right.
by virtue of that collaboration. Can you explain that and explain what happens?
So there's this very interesting set of observations in innovation science that seems counterintuitive. On the one hand, expertise is very important in innovation, and I didn't mention that, but I certainly tell my students, you can't innovate on the basis of nothing. I mean, you have to know something about the field. On the other hand, there is a fairly consistent observation, which is that newcomers to a discipline are the strongest innovators. So how can that be? How can it be that on the one hand, expertise is very important, but on the other hand, if you know less, you're more likely to be an innovator, and presumably that's because you're kind of less acculturated into the disciplinary thinking, right? And I think that that's why transdisciplinary teams are so powerful, because you combine people that have expertise and people who are new and don't know very much, and so they ask very naive questions and form this thing that's much greater than the sum of the parts. The whole becomes much greater than the sum of the parts. So I don't know if that's really the answer, but I just made it up and sounded good as I was coming out of my mouth. So yeah.
The next question comes from Professor David Rosner.
Yes, thank you very much. I have a couple of queries, just historical questions. The first is that I'm worried a little bit that we're working in a frame that actually is very traditional in public health, but may not be applicable to all kinds of very big questions and problems that we're going to face in the future regarding environmental disaster, environmental change, low-level toxicity, etc. I think we could all agree that one of the great moments in public health was not so much what comes out of the lab, but all the implementation of a sanitation system, of a water supply system, of a sewage system that brought public health up against an enormous array of very powerful opposing forces, landlords, city bureaucracies that were being affected by these changes. When you mentioned Herb Needleman as well, his breakthrough, his intellectual breakthrough, was met not necessarily by resistance from the scientific community, but was met by resistance from very powerful forces of the society. The lead industry that had an enormous stake in destroying his reputation.
Yep, that's right.
And he went through 20 years of real hell.
He sure did.
So my question is, when we think about innovation, are we thinking about innovation narrowly in terms of what we can do, let's say, in a laboratory or in a school of public health or in an administrative framework, or are we thinking about innovation in terms of actually challenging very broad forces that have less to do with, that have enormous amounts of power in the culture and within the society? I think that often we have provided our students with a very narrow frame of what we as public health professionals can do, and we've kind of relegated it to the laboratory, epidemiologic studies, science and research, rather than larger thoughts about the political world into which they're going to be acting.
Yeah. Well, you know, let me start out by saying you're absolutely right. I mean, and certainly with respect to Herb Needleman, and you know, I know that story remarkably well from Herb's own lips. And he was basically, the lead industry tried to take him apart for a very long time, and he suffered a lot from that. But I always say, that we've seen the enemy and it is us. In other words, I think it's a mistake. You know, there's no question that larger influences will oppose change. They will oppose many of these innovative solutions because it is not in their best business interest to do anything otherwise. But I would also say that the scientific community is one of the most rigid and hierarchical communities in the world. And we oppose change as much or more so than anyone else. I will give you just one example. It's an old example, but I could come up with so many others, that are more recent. I mean, certainly as I told you, the story of H. pylori and Marshall and Warren. But Semmelweis is an example that I use a lot. Semmelweis was an obstetrician gynecologist who was the first person to propose the idea of hand washing. In his case, it was in the delivery of babies. And I won't tell you the whole story because it would take me too long. But ultimately, what Semmelweis experienced was he was absolutely pummeled by the scientific community. He was thrown out of his post. He died in a psychiatric institution. He went crazy. We have to first say to ourselves, how can we support innovation within our own environments? And it's a discussion that we've had a lot today. But I would also say innovation works at a lot of different levels, as I said at the beginning, or I kind of alluded to. Sometimes innovation can be step by step, and it can be just clever ways to put things together, to kind of move things forward in novel ways. But very often the ground-shifting kinds of innovations are these paradigm-breaking kinds of constructions where lots of people, both in and outside of science, get hurt by a completely new notion coming on the scene. I don't know if that answered your question.
No, absolutely. I think unfortunately, all of our students, we think that innovation means something that comes out of the lab. And I think innovation also needs to come out of
Hugely.
social action.
Oh, hugely. Absolutely hugely. Yeah.
Again, we encourage questions from students. The next question comes from Professor Erwin Redlener.
Hi,
Where are you?
very interesting talk, Dean Ness. Thank you for that. And as you were speaking, I'm thinking that I'm here. I'm thinking that the issue of innovation really has maybe several different concepts under it. It's almost like an umbrella in a sense, because creativity is different than problem solving. It's a very interesting article today in the Times about Steve Jobs, for instance. The creative process at Apple has been anything but group process or inquiry. It is in that particular case, an issue of pure creativity, of ideas coming to somebody who has his own internal insights and drivers, which would be similar for many artists, for instance. On the other hand, there's problem solving, which requires a different kind of innovation that is relevant and appropriate in science, let's say, or in public health in the ways that you were describing. And thirdly, there may be a category of discovery where insight comes from observations. This is frequently the case in clinical medicine, where a relationship between or among various issues, it becomes apparent to somebody in a sort of a lightning bolt fashion. When you teach a course in developing innovation, do you make those kind of distinctions among, let's say, those three and maybe more categories of how innovation is actually created?
Yeah, that is a great question and a great set of insights, and I think you're absolutely right. Part of the reason that it's been very, very difficult to study, innovation science, I would call it that loosely, is a very ill-formed discipline, very, very immature discipline. There's really relatively little literature given how long people have been thinking about this question. And I think part of the reason that it is so immature is because of what you've just said, that these processes are complex. And probably that innovative thinking, creative thinking, whatever you want to call it, is an umbrella under which comes a lot of different kinds of processes. So there has been, for instance, a very limited literature on the neuroscience of innovative or creative thinking. And everybody finds something different, and it's probably because the tasks that are set out for each of those experimental groups are different tasks that actually take different parts of your brain, right? I mean, so, it's just a gamish. I mean, kind of there is no systematization at this point. We don't make those distinctions almost purposefully because this is not so much and it's interesting because I have written this book about this teaching method, which is under review at a publisher at the moment. When I got reviews back from folks who read it and commented on it, they said, "This really isn't a scholarly treatise, is it?" And no, the answer is it's not. It's not meant to be. We're not trying to make those distinctions. We're trying to, with brute force, essentially, try to get people to think differently. I mean, that's what it really comes down to. So I very much appreciate your comments, and they're very insightful. And you're absolutely right. And no, we're too crude to do that.
Great. We now enter the lightning round, and our next question comes from the balcony. MPH student Suriana Vandenberg.
Hi, good afternoon. Thank you for your inspiring talk. My question is actually about the next step. So when you come up with new innovative ideas, I often find that's maybe not even the hardest part, but the execution of these ideas. And if you can, how you support students in this process and finding the money, the time, the people to help them do that.
How am I going to answer this question? We spent the day talking about just exactly that. In fact, one of your faculty provided me with this terminology, which I think is beautiful in this regard, which is that, he just walked out of the room, is that you can think about schools as being like venture capitalists, right? Venture capitalists are brought all sorts of nifty, neat-looking ideas, and they have to sort through what is crazy and what is cool and potentially going to be great, right? And the thing about, and I didn't talk about this, I talked about it a lot earlier today, the thing about innovation is it has a very high failure rate that you have to accept. You have to be a risk taker to be an innovator, all right? You have to accept that failure rate. And institutions have to accept that failure rate, and they have to think of themselves as venture capitalists supporting what they think are the best bets on novel new ideas. So, I don't know, take it back to Dean Fried. I don't know I don't know what to tell you.
We have time for 2 more questions, then final comments by Dean Fried. The next MPH student up is Lucy Almer from the Department of Epidemiology.
Hi, thanks for your presentation. It's really interesting to hear about your thoughts
on
thank you. Innovations.
Such a
and I think you touched upon this, or my question in your last answer. You'd mentioned the importance of expertise when coming to the table with innovation. And I guess as a student, I'm interested in hearing what you think about the balance between focusing on expertise and also focusing on innovation, and how to use that innovation in conjunction with expertise rather than just focusing on the innovation.
So I would say they're massively complementary, and it's kind of, they're both necessary but not sufficient. You have to understand something, you have to understand a lot about, in fact, everything that you can learn about the question to be able to problem solve, as it were. But I would counsel students in particular, I mean, one of the things, there are 2 things that always worry me a lot about students, about faculty too, as a matter of fact. One is that we need to be maximally curious about everything, not just about our own little small discipline. And the other thing is that in being maximally curious, we need to be maximally information finding, right? So I talk about reading broadly. I would like to see every student in this school reading the New England Journal, JAMA, Lancet, you know, an epidemiology journal, an environmental science journal, a policy journal every week. And I'm serious about that. I'm not kidding about that. I mean, I will say personally, I read 10 to 12 journals every week, and I specifically try to read articles that are outside my discipline, outside my area of interest, so I can learn something about, you know, other things that are going on in the world. I also believe strongly in reading outside of science, you know, or certainly outside of public health sciences. You know, read history, read economics, I mean, it is amazing how insights, you know, if you're interested in architecture, read about architecture, but read very broadly, because breadth is just as important, if not more important, than depth.
Our final question comes from the Department of Socio-Medical Sciences, MPH student Liz Ezrani.
Over here.
Thank you. I appreciate your I appreciate that. Thanks.
So I was just wondering, given the number of ideas generated in the group setting, how do you, is there a way or is there a focus being put on incentivizing students or, you know, even in industry, incentivizing the group as opposed to the individual?
Yeah. Well, let me say that I think in the current way that our scientific institutions are set up, we disincent group process, actually. It's not so much a matter of incenting, it's a matter of removing the disincentives, I would say. And part of that is, again, this notion that we have of idea ownership. And students are acculturated very early on into this notion that their ideas can be stolen, right? That these are these gold nuggets and you only have maybe a couple of them in your life. So if you lose your gold nuggets, you're just gone, right? And I think that's wrong on so many levels. First of all, it's quite clear, as we've all agreed, that through group processes, what you do is you elaborate your ideas, you expand them, you appreciate those ideas that really weren't such good ideas. I mean, how many times my husband, certainly early in my career, was my best editor, and you know, I would kind of bring home some great new paper that I had written, and he would say, "You really want my opinion on this?" You know, like, how much do I love my marriage? So it's sharing with other people is an absolutely great thing to do. So again, we have to get past this idea of idea ownership. But the other thing is we have to get past the idea that everything is about being first or last author on a publication or being the principal investigator. I mean, you don't get any credit, you know, classically in the promotion and tenure system for being a really, really fine collaborator. Sometimes you do in some institutions, but in a lot of institutions, it doesn't work that way. So we have to figure out ways to not disincent group process.
So I'd like to end this part and invite everybody to come join us for reception right outside. But Dean Ness, I completely agree with you that reading broadly in every dimension matters tremendously, and the most insightful moments you'll get is from the field that you never even knew anything about. But I know the audience will join me in saying that you also just need to listen broadly. And today's talk is, I think, mind-expanding and will position us in the next generation of what we want to accomplish from the point of view of innovation for all of our future through public health. Thank you so much.